Today we will be discussing vertebral body stapling. We will discuss how patients' lives are affected by this minimally invasive surgery and how the nurses are involved in this process. We will also be discussing how vertebral body stapling compares to other techniques to attempt to correct scoliosis. Also, we will learn how scoliosis affects lives and how this vertebral body stapling is innovative and completely life-changing.
Scoliosis is defined as a sideways curvature of the spine that occurs most often during the growth spurt just before puberty. Although most people with scoliosis don't have enough of a curvature to merit medical assistance, some are required to wear back braces or undergo surgery. Scoliosis can have devastating effects including, but not limited to, chronic pain, low self-esteem, and poor growth. In the past, back braces and spinal fusion surgeries have been used to try and correct scoliosis. Although great temporary fixes, these treatments are not great long-term fixes as they do not allow further growth. Vertebral body stapling does. What sets vertebral body stapling apart from other surgeries and treatments is its use of nitinol staples.
Nitinol is a nickel-titanium alloy that remembers its initial shape. Before the surgery, nitinol used in spinal staples were crafted into a straight line and then submerged into ice water. They must be inserted quickly into the body to ensure that they do not return to the original shape before the surgery is completed. Once the staples are properly inserted, the internal body temperature of the patient heats the staples up, causing them to return to the original shape. This creates a C-shaped clamp to the vertebral column on the convex side of the curve. The clamping into the bone causes the spine to assume a straighter shape through compression of the convex curve while allowing further growth via the concave side. Grace Rego, only 4 years old, kept complaining of severe back pain and could not sit still for even minimal amounts of time. When her parents took her to the doctor to address her back pain, her curvature was at 27 degrees. By the next appointment, the curve had progressed to 38 degrees. Because of her young age and the fact that Grace was still destined to grow, further curvature was inevitable. Because of this, Grace had to undergo many different surgeries, back braces, and eventually spinal fusion. Desperate for a better solution, Grace's parents decided on vertebral body stapling, which at the time was still a relatively rare procedure. 6 weeks after the surgery, Grace's curve was down to 20 degrees, and she was able to start living almost like a typical preschool girl. As a result of vertebral spinal stapling, Grace's scoliosis went from controlling her life to becoming a manageable condition.
This procedure saves valuable nursing time because the patient is not required to go through as many surgeries. Not only is this helpful, but the patient information always has to be readily accessible and up to date due to the fact that vertebral body stapling is not an easy surgery to complete. Because of the complexity, nurses must be knowledgeable about the patient's health and the patient's needs at all times.